Good morning. Thank you so much for being here. I think we're bringing up slides right now. And just one thing is that I probably will not cover the amygdala or the hypothalamus. Always learn a lot more about my body when, when I hear Matt speak. Uh, and so translating some of what Matt talked about in terms of how are we engaging with our clients, how are we more compassionate and come from a more compassionate space, and understanding the biology behind what creates the trauma and what creates the person that stands before us when they come to us for help. And I think, and when Matt finished, he talked about the environment in which our care exists, the environment within which our clients live, the environment that we live, and then what we have to be able to offer those that are standing in front of us, are in crisis in our community, and people we're trying to bring into service. And so I'm here to talk about the environment, and I'm here to challenge you to think about some of the work that we're doing in a broader way, and challenge you to think about how we as individuals in our community think about the broader structural pieces that create the very work that we do. So just talking about the power of policy and advocacy. So one thing is, where are we now, right? So let's start with where we are, meet people where they are. Um, I'm coming from a healthcare environment, as the intro said, from the healthcare for the homeless field. Curious, is anybody here from the healthcare for the homeless grantee? Excellent, very good. How many people here do health services as part of their work? Any behavioral health, primary care? Okay. How many people here are predominantly housing, shelter services, more core COC stuff? Raise a hand, just trying to get a sense. How many people are here who either in their own role or they're representing an organization that do not do homeless services specifically, you do a broader range of stuff? Okay, very good, so it's a good mix. In the last 5 years, we've seen some pretty tremendous policy changes nationally, and I think what we're seeing now is the trickle-down effect to that in many of our communities. One of the greatest changes that has happened in the last few years is the Affordable Care Act and the extension of Medicaid to this population. And so for a long time, most of the people that we served were not eligible for Medicaid. Colorado, to its benefit, expanded a little bit early so we could get people with the lowest income in early. And what we've seen here is we've got tremendous new access to health care through that Medicaid benefit. Now, I assure you, I am not going to be here as a cheerleader for the Affordable Care Act. I could talk just as long about the gaps in that law as there are in the great things happening. Obviously, the law remains a controversial piece. Everyone here probably has an opinion about it. However, it is connecting our folks to health care, and that's creating new opportunities for us. Second piece on where we are here is that we have substantive, credible research in the peer-reviewed literature about the power of housing to improve health, that housing is a healthcare intervention, and that the social determinants of health, like food insecurity, employment, the environment within which people live, all of those things directly impact their health. And it goes beyond genetics. In fact, it is more than just genetics, and it's more than the quality of healthcare you receive, and it's more than just your personal health decisions. All of this gets wrapped up in itself in a ball, but we have so much research that demonstrates the power of what we do in the COC and the impact that has on the healthcare environment. It's really important for reasons I'll cover in a minute. We have targeted federal goals to end homelessness. I think this is really helpful. It's really helped focus us on where we need to be. And I think we have a growing general public awareness of the larger structural issues that create homelessness. We are seeing more and more people understanding and being aware of and understanding the impact of income inequality in our country, seeing political gridlock that I think is frustrating. Regardless of where you are in the political spectrum, I think a lot of people are just frustrated. I think also we're seeing the rising cost of housing is creeping up, particularly when we had a mortgage crisis. And when we had foreclosures happening to largely white middle-class Americans, you saw a growing awareness of how the unaffordability of housing is reaching all classes. And when we're thinking about our justice system, how our police are interacting, particularly with communities of color across this country, are flashpoints, we're really seeing a lot of surging change and a desire for change. I think that's where we are now. I think we have a real opportunity. just to put a few numbers behind things, particularly from the ACA and the Medicaid expansion. Where we came from, when you divide out healthcare for the homeless, and this is the best national data we have in terms of homeless individuals and national data sets. But for the million or so patients that healthcare for the homeless grantees served across the country, about 280 of those clinics, you saw us go from 44% to 67%, so about a 23 percentage point change in the rate of clients that have insurance. So we've gone from, 40% to about 2/3, and that's great in expansion states. However, Peak Vista, you guys came up 60 percentage points from hardly anyone, lower than a third, just remember a quarter, to nearly all of your clients are now insured through Medicaid. That is a tremendous opportunity. Now, the HCHs and non-expansion states are really just stuck. So that's a whole separate issue. But again, thinking about this from an expansion state, a lot of tremendous opportunities and a lot of investments in your healthcare infrastructure. So we're going to frame this around 5 bold statements. And the first bold statement is that never have so many people cared about homelessness. I'm curious, how many people here have been doing homeless services work for more than 5 years? Okay, and in the last 5 years, how many people have noticed you've got new partners, new people reaching out, or just something new going on that's people you've never worked before coming out of the woodwork? Curious if anybody's seen that, right? We've got HUD doing tremendous work through their H2 program to combine housing and healthcare, really doing a lot. HUD has done more on healthcare in the last couple of years than they have ever, which is tremendous to see. But here's just a smattering of the new people who were engaged in homelessness. Anyone can imagine why we have more people caring about homelessness now? It's because they're responsible for paying for their health care. And that's the honest truth. By the way, we're going to talk a lot about honest truth today. So one of the things is that when people are now responsible for paying for something, we talk a lot about skin in the game for our clients. Let's talk about skin in the game for hospital systems and for managed care organizations and for all of the people who are now in charge of either paying for our clients' care or tracking their outcomes or where they go in the system. All of a sudden now, you've got people who care a lot about emergency room visits. You've got people who care a lot about readmissions to the hospital, length of stay, and the cost of that care. You've got new people who are really focused on what are the serious mental illnesses that we have in our Medicaid-eligible population, and who has intravenous drug use coupled with diabetes, coupled with high blood pressure, and cholesterol, heart disease, cancer, and a myriad of other things that make that very difficult for us to solve as healthcare providers when we are discharging people to the street. And we've got now leveraging the work that we're doing on the housing side to say, when you invest in housing, you save in healthcare. Not only is it the right thing to do, it's the cost-effective thing to do. And we've got more and more research in every community showing that. So here's the opportunity. All states, regardless of where they are in the political system, they are revising and making changes to their healthcare system, whether they expanded Medicaid or not. Many actually non-expansion states are doing tremendous restructuring of their healthcare system. How they're doing it absent Medicaid is obviously a challenge. But in Colorado, where you guys do have that tool in your toolbox, tremendous work on accountable care organizations, looking at how we're spreading accountability across more healthcare providers in the system for realizing outcomes. How is this community here in this room part of that expectation? That's really the opportunity, because we're doing what other people need us to do in order to make the inroads to quality, outcomes, and cost in our healthcare system. Thinking about new Medicaid eligibility, Medicaid is a really flexible program. There's 50 different Medicaid programs depending on what state you're in. And Medicaid has got a lot of optional, flexible, new benefits that a state can elect to add. So we can get things like housing plans, case management, the work that we're doing to stabilize people in housing or prepare them from housing. We don't need to do on grants anymore, where we have that instability. We might get a year grant, a 3-year grant, maybe even a 5-year grant. It's hard to staff your people on 3-year grants. Medicaid offers a continuity of those benefits that allows us, just as business people and a nonprofit, to be able to have a stability in our budget. So if we can leverage the power in this room and the perspectives that we have here and the data that we have in all of our systems, we can actually show that covering case management and broader ranges of housing support services through Medicaid will not only save money, it also makes your life easier. And then thinking again about graded access to coordinated care. More talking about coordinated care and quality outcome integrated care than ever before. Again, this is coming down to quality and cost. Bold statement number 2, we can't end homelessness by ending homelessness. Everybody wrap their head around that? So we can do it again. You can't end homelessness by ending homelessness. We are doing a tremendous job of bailing out this tub. We've got the coordinated access. We're going to prioritize folks. We're going to figure out who's most likely to die, who's most vulnerable. We're going to get them off the street. We've got targeted supportive housing vouchers that we're going to make sure get to those right people. We've got federal goals that rigidly define people in categories, right? Now, we know how easy it is to put human beings in categories. And so, if you spent the night in a motel last night, you screwed up that category. But the intention, very frustrating, right, from a healthcare perspective. But the intention here is that we've got we have perfected our laser focus on bailing out this tub. We are creating best practices for what that looks like, what that net looks like. But we are not linking that to turning off that faucet. For every 300 or 400 people we prioritize this year, who comes behind them? What are we doing? And again, we talk about upstream thinking, and we try to weigh, right? As homeless service providers, we only have one piece in front of us that we feel like we have control over. And all of this other stuff seems really hard and intractable. But when we talk about homelessness, everyone here today, we are responsible for cleaning up the muck of what failed public policies have produced. And that's appalling. So let's think about the structural changes that we need to make. Homelessness is just not its isolated issue. This is a byproduct of problems, right? It's a byproduct of poverty, namely, but thinking about everything that goes into it, our education system, our healthcare system, employment, decent paying jobs, everything here really kind of wraps up into it. We can't have an honest discussion about homelessness or injustice in this community or in any community without being honest about the role of racism and sexism. And we have to be square about that in this country. But we don't have a mechanism or we don't have words to allow us to do that. Here I'm going to also make a bold statement, this is a 6th bold statement. This is a fairly white crowd. And we have a hard time talking about race. And we don't have language, we don't have venues, we don't have places where it's safe or permissible for us to have the hard conversations we need to have to move forward. So again, just thinking about how we frame that in. Thinking about also the role of compassion and what Matt talked about. A lot of this comes down to how do we leverage our community's compassion and values to achieve the structural changes we know are needed. Okay, bold statement number 3. We got to get over our bad selves on a lot of this. And so I think what we need, and this is a national piece, but we don't have the best healthcare system in the world. We don't. We have the most expensive healthcare system in the world. It is very true that we have some of the best medical technology in the world. It is true that when you have rare healthcare conditions, this is the place to be. It is true that we do have world-class care for those that can afford it. And it's also true that there are people who travel around the world to get very specific conditions treated at our premier healthcare institutions. All that's true. We are ranked number 37 on the national scale on our outcomes, on our access, and on our quality, because we do not have the best healthcare system in the world. And here's a crazy thing to say, I don't know that the Affordable Care Act is going to get us there. There's more to be done. Here's one thing to be done. This is Congressional Budget Office figures. The Affordable Care Act has produced more buckets of blood, sweat, and tears and screaming matches than one would think possible. And yet, after all is said and done, after all of everything is implemented, we still have 30 million people that we plan to have uninsured in this country. We've not fixed it. It doesn't fix it. Yes, we have made tremendous steps, and yes, we're getting our clients into Medicaid, but we have not fixed the system. And again, only part of these folks are actually undocumented. The rest are they're eligible in some way, but we can't get them into the system. We have a complicated system. Here's another thing, incomes. I know this is probably shocking because, again, I mentioned the growing public awareness of income inequality. We don't earn as much as we used to. And so the real value of our wages has gone down over time. When we look at who's benefited in the last several years, this chart is from the US Census. Look at the bottom two tiers. Since 1967, wages at the bottom of our country have not changed, but wages at the top sure have. We're doing better, yes, some of us, but a lot of us aren't. And when you look at how this gets divided up, it's curious how unequal it is. And again, we can't all be equal, but what about the role of equity? What about the role of progressive systems that allow for a more structured way that income is distributed and held? Again, we have a lot at the top and very, very little, if anything, at the bottom. And this is not scandalous, and I'm certainly not advocating for communism, but we do have a problem. And I think, again, we got to get over our bad selves when we think about really just acknowledging that we have a problem. So let's think about just here in Colorado and comparing Colorado Springs. And this was mentioned before. We do have a gap between what we earn and how much housing costs. And this is what this looks like here in this community, in this state. And we know that, hey, on one hand, we say, why don't you get out there and get a job? Pull yourself up by your bootstraps. At the same time, we don't acknowledge that, hey, there's like one job for every 5 people looking for one, and that job pays minimum wage. So it's hard living in the shelter and working. That's hard. So we put people we set that up for failure. Okay, so how much are we spending on HUD programs that really fund the work that we're doing, right? We get a lot of this. We're going to be having another government shutdown come in the next couple of months, and so hopefully we're getting our counter for that. But you're going to hear a lot more about budget in the news. This is what makes us turn the news off generally. But so when you look at McKinney, a lot of COC grants come out of this. We get $2 billion a year to fund many of our services. But look at what housing choice vouchers, when you combine tenant-based and all of that, it's 20 million. Oh, and then Section 8, another 10. CDBG, about 3. And then public housing, a little over 6. So that's a lot of money that we are putting into our housing programs and community development that does a lot of the work that we do. And I'm curious, how many people here get funding from one or more of these line items? Okay. Here's where we got to get over our bad selves. These are the top 5 tax breaks in our country. The first one, $153 billion a year in foregone taxes because of the exclusion on many of our healthcare insurance through our employer, right? How many people here get their healthcare through their employer? It's all tax-free. It's $153 billion we otherwise would have in the system. We're subsidized through our healthcare. Who else gets a lot of money? Pensions. Who gets pensions? You know what I mean? I'm actually thinking, wow, that would be cool. A pension would be awesome. But at a certain age, you realize that's never going to happen. But $120 billion a year for the exclusion on pension contributions. But who generally gets pensions? Middle class, upper class folks, right? Capital gains and dividends. Definitely the 1% get this. This is the preferential tax rates. This is why many of us pay 30% of our income in taxes and why the wealthiest pay about 15%. Again, $115 billion a year just on that tax cut alone. Now we get down to mortgage interest deduction, $75 billion a year, the 4th largest tax expenditure in this country. We're subsidized in our housing too. We got to get over our bad selves. We're all subsidized. Whether it's through one way or another, our money is a collective pot that we circulate. It's called community. That's what the unity part means. And so how is it that we really think about, it's not this concept of other. oh, other people get publicly funded, or oh, you're just living off the dole. Well, how does publicly funded expenditures make its way into all of our households? Just because I work for a 501c3 doesn't mean that the US government doesn't pay my paycheck. It gets filtered through a nonprofit, but what's the difference? My husband, largely Department of Defense contracting. It gets filtered through a for-profit defense contractor, but it's still government money. You know, all of just thinking about how much public funds go into us. Here's just another graph that I find interesting. Most of our federal housing expenditures go to the very wealthy. All of these slides, by the way, will be made available. So if you want, this is also available at Center for Budget and Priorities. Again, thinking about where do our expenditures go? Okay, so that was bold statement number 3. Bold statement number 4, the world's run by those who show up. I am really excited, actually, about how many people are here and how many people had raised their hands when homelessness is not the most of what they do, the targeted piece. All of us here are part of a community. All of us here deal with different parts of the system that either are responsible for cleaning up homelessness, again, that's failed public policies, or creating a structure where maybe we'll have fewer homeless people coming in, right? Really excited about the idea of how we're creating priorities in the afternoon sessions and thinking about how what is what we do connect to the larger community goals. Like one of the things that I'm thinking about too is last night over dinner we were talking about some of the things that have happened in the community. There's a community needs assessment on housing. And at the same time, we've done a lot of work with coordinated access and asking people, you know, what their needs are, what's going on with them. Have we married those two pieces of data to really show the larger housing gaps analysis? How many treatment beds do we need in a residential setting? Or is that part of community goals? Thinking about how to link all of that and do that analysis. Thinking about how we can really leverage the potential of what we're all here doing today. So part of this is structural, clearly. And part of this is the low-hanging fruit that we know we have in front of us today. So there's a lot we can do in the homeless services sector to maximize our partnerships, to really leverage what each other is doing, make sure we're not duplicating, to really leverage maybe Medicaid benefits for some of the stuff we do really well and are allowable. So thinking about that, thinking about how we're making the best, you know, use of our targeted vouchers, and all of that is very immediate and short-term, and thinking about that. But then also, how do we balance this with the larger structural piece that's the context within which homelessness occurs? This is not its own problem. It is a byproduct of other problems that we are connected to. So thinking about how is it that we engage all those stakeholders that were on that new slide, thinking about how our hospital systems are newly interested in medical respite care, in permanent housing, in thinking about what it takes to keep people out of the hospital or keep them from coming back. These are new folks that have got a lot of money, they've got a lot of political leverage, and they have a lot of community vested partnerships because they're hospital systems. This is what they do. So thinking about how is it that we just create and engage these new partners in a way that really elevates the work we're already doing. Thinking about too, again, collaborating, proving housing works, we've got all that down, but how are we leveraging that data? And how are we, again, getting the outcomes that we want to see, housing outcomes in larger state level plans? Is this part of the governor's plan? Is it part of the mayor's plan? I think the mayor left, so this is one of the questions I was gonna ask him. But thinking about, though, how is it that we're seeding that in there? Thinking about, this is another real powerful thing. We gotta get over old grudges. I come from Baltimore. I sit in COC meetings. A lot of people have been doing a lot of work in their organization for a long time. And we all know that there are people who won't work together. We all know that there's some people in this room have a model we disagree with. Some people in this room will know by name just the, oh yeah, you know, they got an old, that goes back 20 years, or, you know, I don't even know why they feud. Like, you know, that kind of thing. Because it comes down to our relationships. It comes down to our history. Every community is like that. Human behavior is curiously predictable, and Matt can tell you a lot about the amygdala on that as well. That's a separate speech. But we are now at a point, though, where we have the opportunity to move beyond that and develop new relationships based on new partners, new realities, and new windows of opportunities that we have in this country to really put a voice to the solutions that we know are needed. We have a way of also evaluating prior practices and just thinking about where is it that I can change. We talked a lot about change with Matt. This is hard stuff. And so it may be that your model doesn't change, but maybe thinking about how it might change in small or big ways in a new context would be helpful. Thinking about how we involve our consumers and our line staff in telling their story, particularly around people where it works, and we can illustrate and push back against stereotypes that homelessness is not permanent, and that there is life behind homelessness, and that there are solutions that work. But we need not only just to bail out the tub, we need to turn off the faucet. All right, and then here's the big stuff. These are challenging pieces. This is a potential, though. How is it that we find a space and find a language to have the harder structural conversations we know need to happen in order to address the underlying problems that produce homelessness? That's hard. That doesn't just look like city council or how you vote, or that looks like your dinner table. It looks like your Thanksgiving table. You know, it looks like crazy Uncle Larry who is going to say something, you know, that, oh, and everyone just looks down at their plate uncomfortably, you know, that kind of thing, right? How is it that we might just say, hey, what are your concerns about that? What do you like most about that? You know, and again, I'm trying very hard to be nonpartisan here, and there's a lot of names and a lot of things we could throw around here, and everybody comes from a different perspective. But if we can find the language to talk to Uncle Larry, we can find the language to raise a question in a public hearing, we can find the courage to make sure that we are at the tables where these goals and outcomes at the state level are being tracked, and we can leverage what we're doing here, because really, they're not going to get where they need to go without us, and without the services we provide, and without the data that shows that we're doing works. That's why we need each other. That's why this is an exciting time, actually. We need to think about the role of voting. To be honest, poor people don't vote, and rich people do. That's the truth of it. How is it that not only, and it's hard, by the way, to really engage in a political process that is seems at times designed to turn you off. Not to sound like a conspiracy theorist, but that's a strategy too. How is it that we are registered to vote, and that we vote, and that we are registering our clients to vote as well, and facilitating that, providing a bus or a van or something that gets people to the polls? And this is not partisan. This is about civic engagement. This is about being part of a community that values democracy with a small d, I think in one of my, okay, small d, democracy, and thinking about how is it we have engagement, because I think we're at a time when it's really hard to engage. This looks a lot of different ways. Some people love to rally. Some people love to turn out with a banner, and it feels good to yell. And sometimes it can be very cathartic. Matt's also got some good, data about just the value of that cathartic expression in a good old-fashioned protest. But that's not really where a lot of people are, right? This might look differently. This might look like calling your congressman and expressing your perspective. This might look like turning out at a neighborhood association meeting and saying, hey, I got an idea. Instead of arresting people, why don't we better engage X, Y, and Z? Why don't ask questions? That's the hard piece. It's incumbent upon us, because if we don't, I assure you no one else will. And I think one thing too, and Matt and I both do trainings talking a lot about burnout in the provider community. We're being asked to do a lot. Coordinated access, paperwork, HMIS. We are just doing so much with not a whole lot more resources. Burnout is hard. This population can be hard. But I'll tell you, there is nothing like finding the joy that brings us to this struggle, and the community that we have found here, that our kindred spirits on our dedication to this work and the people that we serve is tremendous. And how is it that we are not only taking care of ourselves, but taking care of each other in this work? Because again, we need each other in a way that we haven't in a long time. We've got new windows of opportunity that leverage our power, and we have the ability to speak truth to power because we have the moral upper hand. We have, if it's important, the cost-effective analysis of what we do, and we know that what we do works. So thinking about how we find joy and community here and in our community to be doing this work. So this is an opportunity to actually take out your phones and plug in or scribble down this number. This is a toll-free number. You paid for this number, by the way. So use it, 877-210-5351. If you call it and you tell them where you live, they'll connect you to your member. And you can ask to talk. It doesn't matter, right? And it doesn't even, mostly it doesn't even matter what you say. Call up and express what you want to see happen. They'll take a message. But you know what? Here's the thing. This is funny. No one ever calls. This is one of the things that I learned working in DC and talking with a lot of congressional staff people. They're like, nobody ever calls. Then if we get 100 or 150 calls on something, we know it's like a really big deal. And the same is true at your state legislature. No one ever calls state legislator people. So like totally call them just because you need to remind them that they're there, you're paying attention. But one call, they've got this algorithm. This is how few people call. In Congress, for every call they get, there's like, that roughly mirrors the perspective of 2,500 people. Like this is like they rough it out. And so if your one call can speak for 2,500 people, make the call. I feel like an NPR kind of campaign here. But okay, and which is odd too, because the NPR campaign can get kind of, wears you down after a few days, which is totally the point. But do you ever feel better after you call and you give them like your 25, 50 bucks, 100 bucks or whatever it is? Like you feel better because you participated. And the whole idea of a democracy is that we participate. So give them a call. It's cool, actually, and you'll feel better. I challenge you, you will feel better. Even if you hate your member, you'll still feel better. And by the way, the White House, they're pretty important too. Curiously, it's not a toll-free number. This is something that has to change as well. I mean, those minutes, count for something. 202-456-1111. The lady that answers the phone is so nice. You can tell she's like an elderly volunteer, and she'll take your message. She's very sweet. It also matters they actually collect it all up. They do review it. All right, so sometimes people say to me, hey, this all sounds great. I just really don't know, how do I know where and how to engage? And this is on small stuff. This is on big stuff. It's kind of everybody here is going to be interested in something different. And that's great because we need everybody pushing their shoulder into the collective, but we obviously don't all need to be doing the same things. And some people here are totally fired up to be working on minimum wage or, broader affordable housing or, just some of those things, just getting more jobs into the state. And that's great. And some people here are like, no, I'm going to make sure these 50 vouchers are reaching my core folks. All of that's good. Here's a few action alerts that are put out by organizations that I work with. Obviously, my own organization's Mobilizer. We try to hit big macro structural stuff as well as the smaller stuff in our monthly alerts. But there's a number of things here. Google them, their alert will pop up, subscribe to it. A lot of that will call on you to call your people. So having that just plugged right into your phone makes it super accessible. It takes 30 seconds and you can do it on the way home with your hands free. Okay, so bold statement number 5. We really do have the power to leverage not only structural change, but then also the immediate stuff in front of us. This community has got so much power. I love seeing police here. I love seeing healthcare people here. I love seeing everyone who's both doing targeted homeless services together with a broader services community, because all of this is all tied up in itself. And we have to create a plan. And when we look at the priorities that we'll select this afternoon, thinking about what are the small and large pieces that we can be working on. Because again, this really takes all of us. There's a lot of opportunities here, a lot of new friends. Really excited to be hearing your ideas about where you see opportunities. Thank you again for having me here today. If you love stuff like this, I'm on Twitter, and here's a little bit about the people who continue to employ me at the National Healthcare for the Homeless Council, really just trying to make inroads to making this country better. Thank you.
Good morning, everybody. I'm Kimberly Sherwood with Third Sector Group, a proud partner with the Continuum of Care for this process. I'm here today to introduce somebody who really probably needs no introduction, our good friend Aimee Cox, who is serving currently as the Housing and Community Initiatives Manager for the City of Colorado Springs. And for those of you who know her, she's incredibly spunky, courageous, brilliant. She is of our community and one of our community's greatest champions. You can read all about her credentials. One of the things that I love best about Aimee is that she is a terrific living collaborator, not just giving lip service to it, but lives it and breathes it every day. And she's here to talk to us a little bit about what we can do with regard to housing in our community. Aimee.
Good morning. My name is Aimee Cox, and I have affordable housing. And what this means is I spend less than 30% of my income on housing costs, 30% being the accepted standard of affordability. And in fact, let's see if I can get this right. I spend about 24% of my income to live in this house in Manitou Springs. And I share this with you because affordable housing is not just a poor people's issue. Housing affordability is a concern for most households in our community. Think about how much you spend out of your budget on your housing costs. Housing is generally the biggest cost in a household budget, and housing cost burden, paying more than 30% of your income on housing, has consequences for families and for communities. When we are cost burdened by housing, we invest less in our education and good food and health care and our retirements and recreation, all of those things that add quality to our lives and frankly make our economy work well. And even though the idea of living affordably makes sense to most people intuitively, it's becoming more and more difficult for people across the country. And more important to us here today, it's becoming more difficult for people in our community to find affordable housing. There is simply an imbalance between incomes and housing costs. And as a result, about 82,700 residents in El Paso County live in housing that is not considered affordable. And yet when I go into neighborhoods, when the housing staff goes into neighborhoods to talk about affordable housing, we routinely are met with objections from across all income levels. People believe that affordable housing drives down property values and it brings nuisance and criminal activity into their neighborhoods. And so today what I want to do is begin to change the narrative we have about affordable housing. Nobody should feel ashamed to live within their means. And that will mean something different to each of us over the course of our lifetimes, whether we are young professionals starting our careers and just getting our first apartment, whether we're raising families, whether we're now retired and maybe living alone on a fixed income. Our needs will change over time. And whether we're talking about ending homelessness or growing our economic vitality, and these are connected topics in our community, we must talk about the importance of housing and affording really rich and fulfilling lives. So I want to talk a little bit about affordability. In the United States, about 1/3 of all households are housing cost burdened. That means they pay more than 30% of their income on housing. 19.8 million Americans pay more than 50% of their income on housing. They're severely cost burdened. Over the next 10 to 20 years, we're going to see the greatest housing demand among young and older households. 6.5 million millennials will enter the housing market over the next 10 years, and they're already facing affordability challenges. The share of renters aged 25 to 34 with cost burdens increased from 40 to 46% from 2003 to 2013. And the share with severe burdens, more than 50% of their income, rose from 19 to 23%. And on the other end of the age spectrum, we have a large and growing senior population, and the existing housing stock is unprepared to meet the needs of these folks. Many older adults live alone, have at least one type of disability, and have limited incomes. And as a result, over the next 20 years, the demand for housing units that are accessible and provide connection, as well as supportive services, will grow increasingly acute. In Colorado, 1 out of every 4 renters pays more than 50% of their income on housing. 1 in 3 children lives in a housing cost burdened household, and incomes are not keeping pace with housing costs. Recent estimates from the Colorado Department of Labor show that over 70% of new jobs Over the next 10 years, we'll have starting annual salaries of less than $36,000 per year. The National Low-Income Housing Coalition has identified that the requirement for affordability of an average two-bedroom apartment, you need $36,623 a year. And that's based on a fair market rent of $916. It's potentially more challenging here in Colorado Springs, where we're seeing new job creation with a median salary of $33,261. The 1/3 of job growth is projected in education and health, and those positions pay less than the median wage. About half of renters and a third of homeowners in El Paso County are cost burdened. This is an increase of 25% in the number of cost-burdened households between 2000 and 2012. 62% of seniors who are renting in our community are cost-burdened. We conducted an affordable housing needs assessment. The city and the county did that last year and found there's a gap of about 24,500 affordable housing units for households making up to $67,000 a year in our community. What this means is there are more renters or consumers of housing than there are homes in their corresponding affordable price range. The largest gap in sheer numbers is within those moderate income households making $46,000 to $67,000 a year. It's about 9,000 units. In terms of percentages, however, the lack of affordable housing most seriously affects our extremely low-income households earning less than $17,250 per year. For every 100 households in that price range looking for housing, there are 16 units available. And this lack of housing has very serious implications in our work to end homelessness here. Right now, we have between 50 and 70 veterans experiencing homelessness who have received VASH vouchers, and that is a housing subsidy with case management, and they're looking for a place to live. They have not found a place to live. If they do not find a place within 120 days, they could lose that voucher. So more income, when you have more low-income earners, you need more low-cost housing. So what is the impact? And there is an impact when we don't live affordably. Each additional dollar a household spends on housing represents a potential reduction in our sales tax base. According to the Piton Foundation in Colorado, household spending that is crowded out by housing costs in excess of that 30% accounts for about $2 billion less spending each year in our state on consumer goods. In El Paso County, that's estimated at $235 million. And in a community that is really sales tax dependent, there is an impact. And more important, I believe, to our conversation today is the cost of not housing people. That is very expensive. Our homeless outreach team did a study about a year or so ago, and estimated that the cost to serve somebody who is chronically experiencing homelessness in our community on the street for a year is about $57,000. That's for emergency services, police response, ER visits, jail. By contrast, and we haven't studied permanent supportive housing and the costs in our community, but by contrast, the Denver Housing First Collaborative a few years ago studied their program and found it cost about $13,400 a year to provide permanent supportive housing. So what we need in our community, I believe, is a new narrative, and I'm going to put myself out there as a profile in how families and communities can benefit from affordable housing. Now, I'm going to start by saying I am not low income. I am not low income because of opportunities that I've been given, because of choices I've made, because I've had the ability to work hard, and because I've had a lot of good luck. But that hasn't always been the case. So I was raised in Colorado Springs by a single mom, and I had two brothers, and we lived in poverty. My mother managed a discount shoe store, and she managed her money very well. She would take an 8.5 by 11-inch sheet of paper, and she would fold it into 12 squares, 6 on each side, and that was how she kept her budget, and we kept to the budget. So she managed her money very well, and but the ends never met. And we depended a lot on charity and on government assistance. Well, I eventually grew up, and we were loved. We were really, really loved. So getting back to Matt's comment, I mean, it was not a bad existence. I eventually went to college, and I graduated with honors, and I was accepted into a graduate program, and I opted to take a year off to join the inaugural class of AmeriCorps. And I did this because I wanted to give back to a country that had largely paid for my education, to a community that had provided my family with all sorts of resources, and I felt obligated to give back. And if any of you are familiar with AmeriCorps, they pay a poverty wage. I don't know if that's changed, but when I was there, they certainly paid a poverty wage. And so any savings I had was eaten up in that year. And at the end of that year, I learned I was pregnant. And I found myself back in the same lines that I had been in as a child, waiting for Medicaid and for food stamps and for WIC. And I got married, and I had this beautiful baby girl, and her dad and I worked like mad to get ahead. I got a job as a receptionist at El Paso County Parks, and I made $8 an hour, and I tended bar at night, and he worked 2 jobs as well. And we passed our daughter back and forth between shifts, and at the end of every lease, we'd look for a new place to live. And one day, I just said, this has to stop. We're never going to make a life unless we can pause and take a deep breath and get off this hamster wheel of constant work and uncertainty. And so we made a conscious choice we literally ate lentils for like a year and a half, and did odd jobs and babysat and everything we could to save a down payment to buy this little house in Manitou Springs, and Chris will recognize this house. I was 27 years old, and this house changed my life, and I'd like to say it benefited this community as well. And this house is in Manitou Springs. But within a few months of being in this house, I was able to quit my bartending job. And when I had free time, I joined the community parks board, and I started building playgrounds in my community. And we were very successful. And with that success, I was given a promotion at work to manage park programs. And with that promotion, I was able to go to graduate school. And with a master's degree, I found a better job with the City of Colorado Springs Parks, and I kept building playgrounds and purchasing open space and building trails and doing all the great things that we love in this community. And I had another baby, a son, yay, he's 11, and I put braces on my daughter's teeth. And I continued to see needs in Manitou Springs, and I had a skill set, so I ran for city council, and I got elected. And at a time when our region was experiencing economic crisis, our little town in Manitou Springs came together, and we rebuilt our downtown, and it's a beautiful place to be. And from that experience, I was asked to join the city council in Colorado Springs as the administrator in the first strong mayor form of government. And I sat in that seat and I listened to people come before our city council and talk about the needs in the community, and I started hounding the mayor's office and asking, what are we going to do? What are we doing for community development? How are we going to address housing issues? And the mayor ultimately asked me to come over and help lead an initiative to end homelessness in Colorado Springs. So being up here and able to speak to you and present this today is a sort of homecoming for me. Because when I talk about affordable housing, I do not talk about projects. I talk about family. I talk about vibrant public spaces. I talk about community. I talk about a life afforded. And I was able to do this in the market. That is becoming more and more difficult for people in our communities these days. And so we really need to open the door to more housing that makes sense. And we need to get families off the hamster wheel and onto the merry-go-round to really fully enjoy this one life that we know we have been gifted. This is all we know, folks. So we want to make the best of it. And I'm not here to tell you today this is how we're going to do it step by step, but I can tell you how we're going to get started. And that is by knowing the issues, what we're learning about today, understanding the need in our community. It's going to be to put a human face on affordable housing. This is not just about buildings. This is about people. This is about families. And we're going to create the public will to respond with our colleagues, with our neighbors, with our elected officials. We are not going to end homelessness without housing. And I want to thank you all for being here today to be a part of that conversation.